All right, hello and welcome to the daily coronavirus update live from Fox. My name is Mike Mibach. We are streaming right now live online at coronavirusnow.com. We start this usually every day around 10 o'clock on the West Coast, 1 o'clock in the afternoon on the East Coast. We just watched President Trump and the Vice President hold a news conference in their daily briefing regarding the task force and what is being done. We heard the president say this is not about one particular state. This is about every American coming together to prevent the coronavirus from spreading. I wish I could sit here and tell you that the numbers are not going down, but they're not. The numbers are on the rise. Across the world, 183,000 cases. Closer to home, though, in the United States, there are now about 5,000 cases. A couple of the states being hit hardest right now. New York, more than 1,300 cases. Washington, more than 900 cases. And the state of California, more than 550 cases. Across the country right now, at least 93 people have died. Again, the president just wrapping up that news conference. It lasted for about an hour and a half and discussed the FDA's new policy to further increase testing and also the role that fast food restaurants can play with their drive-thrus.
Last night, the FDA announced groundbreaking new policies to further increase testing, very substantially so. All states can now authorize tests developed and used within their borders in addition to the FDA. So the states are very much involved. They have been involved from the beginning, but we're stepping it up as much as we can, and the testing procedures are going well. And within a short period of time, all of the private labs will kick in. This has never been done before, and it's going to be something I think it's going to be incredible if it's done properly. And these are great companies. These are among the greatest companies in the world, actually. So the state's going to be dealing through themselves and with local government, local physicians, local everybody. They're also dealing with us. But we have a tremendous testing capacity. Today, we're also announcing a dramatic expansion of our Medicare telehealth services. Medicare patients can now visit any doctor by phone or video conference at no additional cost, including with commonly used services like FaceTime and Skype, a historic breakthrough. This has not been done before either. In addition, states have the authority to cover telehealth services for their medical patients. And by doing this, the patient is not seeing the doctor per se, but they're seeing the doctor, so there's no getting close. During this time, we will not enforce applicable HIPAA penalties so that doctors can greatly expand care for their patients using telehealth. So the penalties won't be enforced. We encourage everyone to maximize use of telehealth to limit exposure to the virus. It's been a very successful method of communication, but never used on a scale like we're going to use at telehealth. And you'll be able to also better maintain hospital capacity by doing this. Earlier this morning, I spoke with executives from America's fast food industry, Wendy's, McDonald's, all of the big ones, Burger King, and they were great. We're talking about the pickups in light of yesterday's guidance you heard. To avoid eating or drinking at bars, restaurants, or public food courts. We discussed the important role that the drive-through pickup and delivery service can play in the weeks ahead.
Standing behind the president there, you can see the Treasury Secretary, Steve Mnuchin. And it's important to note that during that news conference, he stepped up to the microphone and said that the markets will remain open. Was very emphatic about that. In fact, he was walking away from the microphone when someone asked him that question. He came back into the room and said, yes, the markets will remain open. He also said that they are very close to working on $1 trillion stimulus package. There is a possibility that every American could get some sort of direct cash, possibly up to $1,000. Here is how the markets are reacting right now. It's up and down throughout the morning until that news conference. You can see the Dow Jones is now trading more than 560 points. The NASDAQ and S&P 500 are up about 4%. Throughout the rest of the show, we will be on your bottom of your screen. You can see the numbers right there. That is the Dow Jones. We're going to keep that up throughout. Is COVID-19 intensifying around the world? Let's get right into it. I want to bring in Dr. Pradeep Kumar joining us from the Fox 7 Austin newsroom. Doctor, thanks for joining us.
Oh, thanks for the opportunity.
Of course, I kind of like to start this one a little bit wide and then go narrow. Would you say that COVID-19 is intensifying around the world?
Oh, absolutely. There's no doubt about that. Our ability to test everybody that's infected is still limited, and there's a higher number. You quoted a number of 5,000 cases right now, and I think it's probably safe to say that the number of cases is higher than that, and as soon as we bring testing on board everywhere, we're going to see these numbers go up. So absolutely, COVID-19 is increasing across the world.
Healthcare professionals, people in your industry, my concern is here, look, they've been working nonstop across the country in some cases. And in some cases, we have seen doctors who have tested positive for coronavirus. How big of a concern is it that nurses and doctors could be now part of the problem when they're out there trying to solve the problem and take care of all of us?
Yeah, it is a question. And in fact, it's happening here in Austin. I know from friends of friends that a local physician here in Austin has tested positive already. And so we know that this is happening, but this is a risk that was always present. This is part of what we do. This is our field. We're at the front lines. We're taking care of patients, and this is a risk that we assume. Now, that having been said, it's appropriate for us to be equipped with all of the equipment, the personal protective equipment that we can get so that we can protect ourselves appropriately. And as those come online, as we have better access to those, I think that nurses and doctors and all the people that are vital to take care of patients, once we're protected, I think that we'll feel comfortable and safe. There's always going to be a risk, but this is what we're here for. We're here to take care of patients, and we're going to assume that risk, but try to minimize it as much as possible in order to provide care.
We were talking about the news conference that just wrapped up at the White House. One individual who was also there was Dr. Anthony Fauci. Let's listen to some sound real quick, and then I'll get your reaction to what he had to say.
I think we need to say it over and over again. When I was young, a long time ago, I felt that I was invulnerable, the way I think many of us feel we're invulnerable. And when we're asking the young people to help us with this mitigation strategy, by staying out of the bars, staying out of the restaurants, really trying to distance yourself. Don't get the attitude, well, I'm young, I'm invulnerable. You are, well, in some respects, you're certainly less vulnerable than I am. However, what you might inadvertently do, and I know you don't want to do that, you don't want to put your loved ones at risk, particularly the ones who are elderly and the ones who have compromised conditions. We can't do this without the young people cooperating. Please cooperate with us. Thank you.
All right, Doctor, what do you think of that? I mean, he was very loud and clear about that. A direct message to the younger generations. This is not a joke. Don't keep doing what you're doing. Don't go to the bars. You may not be, a possible candidate of someone who's going to get the coronavirus because of your age, but you could impact others out there across the country. That message needs to be delivered, Doctor?
Yes, first a word about Dr. Fauci. When I graduated med school over 25 years ago, he gave our commencement address. And so even back that long ago, he was a preeminent scholar in the field. And, he was giving us our commencement address. So I have this great respect and admiration for Dr. Fauci that's longstanding. And he's right. The point he's saying is what I just told my neighbor the other day, who was elderly, was above 60, and I went and checked on him and make sure he had all the food that he needed, that he wouldn't have to go out in public. And he wanted to go to Costco anyway, just because, he needed some things. And what I reminded him is that even if you don't get infected, you're putting other people at risk. If you go to Costco and you're exposing yourself, and then you go expose other people, we're all in this together. Like, even if you yourself are not going to be affected significantly, even if your symptoms are mild, the idea that you can go somewhere and pick up the virus and then transmit it unknowingly to somebody else is real. This isn't fake. This is all of us in together. And even those people that are, what Dr. Fauci is addressing, those people that are young, that are not vulnerable to having the worst case scenario, they're still part of the problem when you go out and you interact in places where the virus can be, and then you go back and you interact with somebody else. There's a potential for spread that we're all assuming, and we're all participating in this. It's everybody. We're all in it together, and I couldn't agree more with Dr. Fauci.
Yeah. Follow the guidelines that are out there. Do not gather. Dr. Kumar, thank you for your time. We appreciate it.
That's right.
Just the other day, I was in an argument with my own mother. My mother lives with me. She's 81. She was adamant about going to the gym, and I had to shut it down. And she just had a very difficult time not understanding what I was talking about. And I know I'm not the only one dealing with this. There are a number of people who live with their parents. But it was important to say, do not go to that gym. You know, I am a father, I have children. Finally, we worked it out. All is good at the home. But you know what? It's time to stay home and follow the guidelines. San Francisco Bay Area. If you haven't heard about it, there is a shelter in place for 6 of the 9 different counties in that area. People being told, don't go out. Maybe you can go on a walk, but don't go out. It is a shelter in place that's going to last for up to 3 weeks. Let's check in with reporter Ali Rasmus from KTVU Fox 2 there in the Bay Area, and kind of unprecedented that this is happening there.
Yeah, 6 Bay Area counties, 7 if you include Santa Cruz County, just to the south of us here. But this shelter-in-place order is in effect. It started at midnight this morning, and it remains in effect for the next 3 weeks, so through April 7th. Now, during this shelter-in-place order, there are still businesses allowed to remain open, including grocery stores. We're standing right next to one. We're in the Castro district, by the way, of San Francisco, which is normally a very pedestrian-friendly, busy neighborhood that is noticeably quiet this morning. But there's a sign out here that says the grocery store is limiting the amount of customers in the store in order to maintain a safe and pleasant shopping experience. They're talking about this social distancing that we've heard so much of. Now, right now, there's nobody in line. If we can go around here to the entrance, there's only one way in. No one's in line. But earlier this morning, right when the store opened, there was a line of about 30 people. And there was a security guard out here letting just 10 people in at a time. Now, along with grocery stores, pharmacies, and restaurants are allowed to remain open for takeout and delivery only. Hardware stores as well as gas stations and banks. Now, only people who work in essential businesses and services are supposed to be going to work with this order. We're talking about healthcare workers, police and firefighters, delivery drivers, journalists, taxi drivers, Uber and Lyft drivers, and people who work for public transit agencies. And we should mention that the public transit in the Bay Area in these 6 counties is still running. So BART is still running trains, even though their ridership is way down, more than 60%. We've seen the San Francisco Muni buses going by throughout the morning, although taking a look inside of them, we can see maybe 1, 2 people inside, some of them with masks. So there definitely is a sense among people around here that they don't want to take public transit. We spoke with a taxi driver this morning, and he says he's been getting a lot more business because folks who don't want to take public transit are calling him instead. And he says he has this very strict protocol. Every time someone gets out of his cab, he wipes the whole thing down with Lysol, and he keeps the windows down even if it's cold, just to increase ventilation. Now, this is going to be in effect for the next 3 weeks. Things that are closed, non-essential, include gyms. As you mentioned, Mike, your mom not wanting to go to the gym, or wanting to go to the gym starting today. She won't be able to anyway. So gyms and also bars and clubs are to remain closed for this 3-week-long shelter-in-place period. This is estimated to impact about more than 6 million people in these 6 Bay Area counties and Santa Cruz County just to the south of us. Mike?
And I just heard Ali, the mayor of New York City, had mentioned about whether or not he would be interested in doing something similar there, and he said there is a possibility that they would do something similar. Just to clarify, though, for our viewers, too, when it comes to public transportation, it's not even on the table that they would shut down any of the major transit, you know, whether it's the ferry system, the trains out there, BART, those will be operating?
They will be operating, and the latest word from officials with BART, which is the subway metro system Bay Area wide regionally here, is that they say they're an essential service because there are a lot of healthcare workers and food service workers, people who work in grocery stores, people who rely on that public transit system to get to work to perform these essential jobs. And so that's why even if ridership is way down, these buses and trains will continue to operate, at least for the time being, at least for this 3-week shelter-in-place period.
All right, Ali Rasmus from KTVU Fox 2 there in the San Francisco Bay Area. As I mentioned, that could be something that other cities and regions in America may be considering. I know New York City's mayor said he was thinking about doing that. If you're just joining us, you are watching the Daily Coronavirus Update live from Fox. My name is Mike Mibach. I'll be mentioning that throughout the newscast as we move along. Some people are dipping and going on the stream. By the way, we are live stream at coronavirusnow.com. The stock market yesterday, wow, what a drop that was. today. It is starting to bounce back, although slightly right now. You can see the Dow Jones is up more than 460 points. This on news from President Trump and Treasury Secretary Steven Mnuchin that they are working on what could be $1 trillion stimulus, tax payments deferred, even checks, actual cash to every American out there. I want to bring in George Nichetti from Morgan Stanley Wealth Management to talk a little bit more about this. George, did you listen to that news conference?
Michael, I was all ears.
Okay, what was your reaction to that?
Well, basically, we've had a lot of news conferences, and there's 5 things that the administration has talked about that have to happen. 5 things. The first thing is health stimulus. We need to get testing done. Then we can quantify the actual results, and the fear out there can now, we can look at it numerically so we can start solving it. Right now, we don't know, so there's great fear. Second thing is monetary policy. Jay Powell, the Federal Reserve Chief, has said there will be liquidity, and he's taking steps to do that. Fiscal measures. The House and the Senate are voting on bills, a bill right now and other bills that will provide some fiscal measures, essentially to help companies, to help families, and to help individuals. When we see those things actually happen, we see people actually being tested, fear will start to subside, people will get more confidence, and then we can start really talking about the recovery.
Recovery, well, but what about global recession this year? Is there a chance still about that?
Absolutely.
Yeah.
The global economy and our local economy was growing slowly. So you have an event like this that essentially shuts things down, and then you have an oil crisis on top of it. It could lead us to a recession. But for recessions to happen, you have to have 2 negative quarters in a row. And so, the first quarter is ending now at the end of this month, and it probably will not be negative. We've got the other 2 quarters. And at Morgan Stanley, our base case basically is about a 15% chance, the probability of us coming back in terms of our economy in the 3rd quarter. So we could have a negative quarter there. 15% isn't very high. We expect really more towards the end of the year, the beginning of next year for the recovery part. But these 5 key points that I talked about have to be done first. That quantifies everything. That gets rid of the fear once you know exactly what you're dealing with. So we're getting closer. When we start to see results, people test it, money come into our pockets to help subsidize us while people are out of work and being laid off. That will make a big difference in how people feel.
Talk about being laid off. I mean, it's estimated that there could be 1 million people who lose their jobs in the United States just this month. The ripple effect that could have in the months ahead, George.
Well, everybody is looking out into the future without any data to really look at. So it's a little premature to say that. There's a lot of overreaction. We have to prepare for that happening. Anybody who's working, regardless of your income, whether you're an hourly worker, part of the gig economy, very wealthy, you need to put away cash because you may need a bridge of a week or 2 in between unemployment happening, insurance, and other kinds of cash flows that you may be getting. That's part of financial planning, having some cash reserves. So people need to start doing that just to protect themselves in the short term.
I haven't looked that closely, but it seems that Amazon right now is the only one who is currently hiring out there. Of course, there probably are other companies. What about this whole direct cash to citizens proposal that I heard yesterday? It came up again at that news conference with the president, and it seems like the Treasury Secretary was interested in the idea, didn't quite put his stamp of approval on it, but $1,000 maybe in every American's hands, yes or no?
Well, again, this is one spoke on the wheel. Could it happen? Sure. There's a lot of spokes on the wheel. We really have to see what's implemented, but our real focus should be on getting people tested and reducing the spread of this virus. That's the key to this whole thing first.
And I say, even if you got the $1,000, we just had a report from the Bay Area talking about the shelter in place. I mean, people aren't necessarily going out and spending the money, putting it back into the economy.
No, people are not spending money, and that's why, when the recovery happens, there's going to be a big pent-up demand. We're going to see a hockey stick in spending, and then it'll probably be a sluggish economy after that because these things have long-term effects.
We heard in that news conference also, real quick, the airline industry said that taking a bigger hit than it did, post 9/11. How long does it take for an industry like that to get back to where it was, say, at the end of December?
The airlines are a capital-intensive industry. It costs a lot of money to prepare for our safety and to make sure that we have transportation really throughout the United States. That's an important feature. So I would expect when we start talking about bailouts, when that conversation comes, I expect airlines to be on top of the list.
Should investors, and I know there's people at home who like to invest, but should they be looking, George, for companies that have the cash to really get through this entire this pandemic that we're experiencing? Are those the companies, if they are looking to make money out there?
Well, obviously, any company that's in the consumer staples area is doing really well, because we all need just basic things while we're living at home. Consumer discretionary won't be as popular. However, those are people that are really looking more for day trading. We like to look a little bit more long term. We just sold a bunch of long-term treasuries because they're really selling at a premium right now. We took that profit and we bought some large cap growth stocks and mid cap growth stocks, because we know that we're buying extremely low right now. So if an investor has time, then they're going to be able to recover and really get a nice profit in those particular ways. But we should all, pay attention to our portfolios, make sure they're diversified, and don't do any knee-jerk reactions because of fear. Really think through things on a good academic basis, and you're going to be better off than if you didn't do that.
All right, NASDAQ and S&P 500 both up more than 3%. The Dow Jones up more than 2% right now.
Yeah, good to see that.
Yeah, good to see that for sure. George, we appreciate your time. Thank you very much.
Okay, Michael.
Okay, want to bring along some breaking news right now from the state of Texas. I'm just reading this for the first time, so I'm looking down on it. But the governor there, Greg Abbott, today activated the Texas National Guard to be prepared to assist with the response efforts tied to COVID-19. Again, Governor Abbott activating the Texas National Guard to be prepared in whatever capacity the Guard will be used to respond to COVID-19. Interesting to see if other states will follow. All right, just to let you guys know, if you're dipping back in right now, you are watching the Daily Coronavirus Update live from Fox. My name is Mike Mibach. We are live streaming right now at coronavirusnow.com. We always start every day, 10 a.m. on the West Coast, 1 p.m. on the East Coast. We talked about the San Francisco Bay Area and the shelter in place affecting nearly 7 million people. Do you go out? Do you not go out? Well, authorities there are saying it's in your best interest not to go out. Let's check in with reporter KTVU from Fox 2, Sarah Zendenam. And an interesting story to this, because I know people can go out there, Sarah, especially if they need to get groceries. Grocery stores are open. But you stumbled upon one interesting aspect, one different angle where they're helping senior citizens.
That's right, Mike. And to give everyone an idea of where we are, this is Zanotto's Willow Glen Market. We're in San Jose, California, about 50 miles south of San Francisco. And this spot, very, very interesting and very important thing that they did starting today. They are only allowing senior citizens to come into their store from 8 o'clock in the morning to 9 o'clock in the morning. And then after that, until they close at 7 p.m., everyone is welcome. So, of course, this is all in an effort to protect that very vulnerable population against the coronavirus. Now, a way that they're enforcing it, something that we found interesting, there was actually somebody at the door, and she was telling people, this is senior shop. You have to be 60 years or older. And if you're not, then you basically have to turn around and wait until 9 o'clock in the morning to come back. So the employees did have to turn away a couple of people, but it is a very, very important thing during this very sensitive time. Of course, like I mentioned, this vulnerable population really at the highest risk of getting coronavirus. And this is a family-run market. It's been around here in the Bay Area for decades and decades, and they always do a lot to really help their community out. They were telling us that back in 1989, we had a really bad earthquake here. It's called Loma Prieta here in the Bay Area. All of their markets basically came crashing to the ground, but they did still have some supplies, so they delivered that to people in need. So this is just kind of the vibe of this market. They really want to help the community out, and there are a lot of elderly people here in San Jose. So the rule basically, from now until further notice, from 8 a.m. to 9 a.m., anyone 60 and older can come to Zanotto's here in San Jose, and they can shop for that 1 hour. Basically, social distancing, a huge, huge thing right now. They really want to give the elderly population, which of course, like I keep mentioning, most vulnerable for getting coronavirus, they want to make sure that they feel comfortable and feel safe while they are grocery shopping, because I think that's a little bit of a misconception. People are a little bit confused about what this shelter in place actually means. People can still come to grocery stores. There was actually a line all the way down this way. It has cleared up now. The reason for the line, this line was because they were only letting a certain amount of those elderly people in at a time, because even though there were a lot of people that wanted to take advantage of that 1 hour of shopping, shopping, they still wanted to make sure that people maintain that social distancing once they got inside the store. So you can see, if you want to kind of move the camera down this way, you can see not a line here at all. Everyone that wants to come shopping here now can until they close at 7 o'clock tonight. But tomorrow they're going to start again at 8 o'clock in the morning until 9 o'clock. They're going to let people 60 and older come into their store. Really an incredible thing being done here at this Bay Area supermarket, Mike.
Yeah, Sarah, it is a great story. I'm wondering, though, you talk about the social distancing, and that in turn made it a long line outside for all those seniors trying to get in because they could only allow a certain amount in during that time. Is there talk about extending it, maybe making it to 2 hours for the seniors, possibly 3?
That would definitely be the good idea because, of course, in that 1 hour that people were here, they were lining up. And, of course, there was that concern about that social distancing to make sure everyone was 6 feet apart. Some people were a little bit closer than that to try to get as close to the front of the building as possible. But really, the owners of this family-run market tell us that they will do whatever it takes to keep this vulnerable population safe. So they're constantly coming up with new plans, developing, changing. So it's really just a matter of time before they may change things. They may keep it the same. It really all just depends on how this entire coronavirus pandemic shakes out.
All right. Sarah Zenonam with KTVU Fox 2 there in the Bay Area. Sarah, thank you for that report. I stayed home yesterday from work to homeschool my 2 children. I did get a chance to go out, and I actually went to our own grocery market, and it was packed. It was the most crowded I had ever seen that market, and people were filling those carts all the way to the top, if not beyond. I want to bring back Dr. Pradeep Kumar from the Fox 7 Austin newsroom right now. And well, I'm curious, Doctor, what's your take on the whole shelter in place? I mean, it's happening in the San Francisco Bay Area. It is being considered in other parts of the country. You would give your thumbs up to this?
Yeah, I think it would work. I mean, if you were emperor or empress of the entire world and you wanted to have this virus run its course as quickly as possible, if it were at all possible, you would just have every human just stay in their house for 2 weeks and not go anywhere. And you would have, EMS available for those people that got sick to transport them from their house to the hospital. If you could just freeze humanity and have nobody move anywhere for a couple of weeks so that you couldn't transmit it human to human. Remember, these viruses don't have wings. They can't fly. They are transmitted human to human. And so if you could just hold everybody in place, then we could get through to the other end of it, and you could start seeing a decline in the number of new infections. But that's just impossible. We can't have that kind of control. And so advising the populace to shelter in place is a very wise idea.
All right, I want to get to some viewer questions. Before I do, I want to play off something you just said. Surviving in the air. I've heard, I don't know if there are rumors out there, at least where I live, but that can COVID-19 survive in the air?
There's no evidence of that. There's no evidence that it's surviving aerosolized. What happens is an infected person sneezes or coughs and they aerosolize the COVID-19, but that's going to fall down. It's not going to fly away. It's not going to remain up in the air for a prolonged period of time. It's going to fall down and it's going to survive on hard surfaces for a finite period of time. And it doesn't just fall onto the hard surfaces and dies. It falls on the hard surfaces and it's still there, and you can touch that area. And once you touch that area and you got some virus on your hand, and you touch your mouth or you touch your nose and you get it inside your mucous membranes, that's how a person gets infected. Alternatively, if you're in front of somebody that coughs and that COVID-19 is in the air and then you inhale that, that's another way to get infected. There's no evidence that COVID-19 is streaming through the air.
All right, let's get to the viewer question right now. And if you do have a question, you can always reach us on Facebook. But here's number one here. After 3 weeks when we stop social distancing, will we see a new spike of cases? Here's the follow-up question. Are we going to be social distancing forever? Doctor, to you.
I really hope not. Of course, like everybody would say, this is really unprecedented, and you really don't know what the future is going to bring. And it would be silly for any of us to make any predictions about what we're going to see on the other end of this. Now, there's an entire spectrum. It could be really easy, and hopefully what we're all aspiring to is that we socially distance, we reduce the spread of it, and then we could go back to life the way it used to be. And there's every reason to be optimistic about that. You know, 100 years ago, when they keep talking about the Spanish flu in 1918, after that was over, we have the influenza, but we haven't been worried about that kind of pandemic for 100 years now. So there's every reason to be optimistic. On the other end of it, I mean, if you want to think of a worst case scenario, you could have, COVID-19 become endemic, not different than measles or mumps or rubella or anything like that. And there could be a certain amount of virus that remains endemic in the human population. And so there's a spectrum of possibilities that we could see on the other end of it. But I have every reason to be optimistic that this is a temporary phenomenon, and it's quite probable and likely that we'll be on the other end of it and we'll go back to life the way it used to be.
Let's hope so.
I'm hopeful.
Let's hope so. All right, here's the second question. This is tied to prescriptions and seniors. How should seniors get their prescription medications when they are in isolation?
That's a great question, and these are the things we were talking about in December and January when the epidemic was just still in China and starting to escape from there, and we were hoping that people would get 90-day prescriptions, and we're advising all of our patients, when we're refilling their meds, I was anyway, to, let's get you a 90-day prescription, make sure you fill that because you don't know how you're going to get it going forward. But right now, I think that with the measures that the government is taking, along with the pharmaceutical industry and the pharmacy industry particularly, I think that, just what we're doing with testing and with foods, I think prescription medications are going to come online in a similar fashion, that you'll find that these pharmacy chains are allowing us to drive up and just pick up our medications and go. And I think there's going to be an infrastructure that's set up particularly for the elderly population and for those people that need medications that are so vital, diabetics, high blood pressure. These are vital, important health conditions to remain on top of. And you want to maintain social distancing while still taking care of your health. And I'm very optimistic that soon online, along with food and water, that we're going to be able to get our medications in a way that avoids great time of social contact.
Sure. All right, Dr. Kumar, one for the road here before we let you go. You kind of touched on it.
Of course, there's already, mail-in pharmacies and things.
Yeah, one more question for you here. Can coronavirus, and you kind of touched on this a little bit, but can coronavirus stay on your clothes? What precautions should be taken at public laundromats?
Hopefully at the public laundromat, you're doing well because you're going to be sitting there washing those clothes. And there's no evidence that COVID-19 is going to survive the wash. I think you're pretty clear on that. Now, what's more risky about the clothes is it's not going to survive on your clothes that long either. It's like any other hard surface. It survives in the human. There's only a finite period of time that it can thrive or survive when it's not in a human. And so the clothes are not any different than hard surfaces. You have to limit your contact with anything like that. And so, but when you wash your clothes, it's going to destroy the virus as well. So along with your hands and your clothes and things like that, I don't think it's going to survive very long on that. It's touching your hands to your face, to your nose, touching other people with your hands, then they touch their own nose. The way it's spread is through, so far, mucous membranes, and now there's evidence that it all could be found in stool, that it might cause a diarrheal illness, that it's also fecally orally spread, which just still means person-to-person spread. And surviving on inanimate objects such as your clothes or hard surfaces is temporary and short-lived. It's not something we need to be overly concerned about.
All right, all great information. Dr. Kumar, thanks again for checking in. I appreciate it. All right, you're watching the Daily Coronavirus Update live from Fox, everyone. My name is Mike Mibach. We are live streaming right now for you at coronavirusnow.com. We start 10 a.m. on the West Coast, 1 in the afternoon on the East Coast every day to give you the latest information about this pandemic that is taking over the world right now. Let's talk about right now something overseas in Italy. I want to bring in our next guest here, Rafael Di Furia. He is a California native living there in Italy and not too far from where Italy had its first reported death. Rafael, thanks for joining us.
Hello, Mike. Thank you so much for welcoming me and having me on today.
Yeah. So tell me more about your actual location there in the country to where the first reported death is or was.
So I live about, say, 20 miles away from the city where this first death happened. But the village where this individual was from, it was an elderly man. I believe he was 78. And that was actually a bit closer. So where I live is in the Veneto region. It's basically a state. Think of it that way. So because of how close we were to the location, the original location of this, one of the first 11 lockdowns here, that started making some of us here in my city called Rovigo very concerned, but there was still that kind of sense of it's that thing in that place over there for
Right.
now,
Yeah.
but still very close.
So when you say the lockdown, explain, I mean, we're seeing that happen here in the States in various cities, shelters in places,
Yeah.
but what was the exact lockdown? What happened?
So it came in stages, and the way that it happened was it first started out with 11 red zones. Then from there, it's about, say, maybe a week or two later, it spread out to the Lombardy region, which is where Milan is, and as well as 11 provinces, which are basically the equivalent of an American county. So one of those counties also happened to be very close to where I live. And so immediately for us, it all came on so fast that there was no real way to prepare for it. I've spoken to many people here through my YouTube channel that talking about this situation, and I've been hearing reports of what's going on, firsthand accounts, and people just didn't know what to expect. And by the time the lockdown was happening in Milan and the second set of 11 regions, people they didn't know what to do.
So, you know, outside of China, Italy has the most reported cases, around 27,000. You know, I don't think you've had the answer as to why so many there, but what's the talk there in your town about why so many cases there are?
So specifically in my region where I live, there was a big concern because we do have a large population of people who do go back and forth, because we have a lot of students from here that go there and a lot of students that are from there that come here, but also tourism. I live, say, about in terms of the Bay Area, if you were to go from San Anselmo to San Francisco, that's how long it would take me to get to Venice on the fast train. So because of how close we were to that and so many people traveling in and out, there were whispers in the background that people had in the back of their mind what would be happening. We didn't know how the lockdowns would be happening. We didn't know if we would be affected by this. So I can't help but wonder if the travel was what really brought it to us here and created this situation where Italy has become a victim of this global pandemic, as well as America and every other nation that's dealing with this.
And we hear words of fear, we hear anxiety, we hear panic. What's the mood there right now?
I'm
What
sorry,
is the mood?
I just want to stop you right there because
Please do.
that is something that I've been so frustrated with, as well as a lot of other people here in Italy, that 99% of the people, even I would go as far as saying 100%, none of us have seen this panic. There was on that first Saturday, there was some panic buying, but after that, it kind of became just this sense of concern. From there, even I would say now there's a little bit of fear, but people are taking this in stride. They are handling it surprisingly well. And the way that the country is coming together, in my opinion, has been so heartwarming and so impressive. Even just before you guys called, there were people out because at 6 o'clock, what's been happening is people go out on their balconies and play music. And even just the other night, we were waving flashlights at each other from window to window, balcony to balcony. So it's really been a beautiful thing to see how even in this difficult time, we've been able to come together from a distance, of course. But I really think, though, that it's not just us, of course, that we as a global community need to come together.
Sure, that's interesting because I'm curious, you're seeing the news here in the States. I mean, I was at the store yesterday. I saw panic buying, and I've been seeing it now for a good week.
Been very shocking.
So what do you think, what do Italians, when they look at us in America right now, are we overreacting?
So there's kind of two sides.
Okay.
As far as buying goes, a lot of people here seem to have the opinion that Americans are overreacting, especially because our shelves, if I went to the supermarket right now, it's easier said than done because we do have some restrictions on the ability to go out, but the shelves are fully stocked. The only one item that I haven't seen in getting close to a month, maybe a little bit more, or a little bit less. I'm losing track of time here. All the days are coming together. But hand sanitizer, that's been the one thing that's been the most difficult to find. And in some areas, high-proof alcohol for people who want to try to make a DIY at-home hand sanitizer.
A lot of people here in the States are mad because we don't have enough tests. Would you say that you have enough tests in Italy?
So, as a non-medical professional, I'm not qualified to answer that question, but I do again have to say that I'm very impressed by the Italian government's response to this issue. And it makes me almost concerned to see how late into this that America has come, and makes me genuinely concerned for my family that still lives in Marin, who are now living under the shelter order, and how they might be dealing with the situation in a different way than how we have, because we've been closed down in different ways for a bit longer now. Yes, it did come here first. At least we started noticing it here first. But there have been the lockdowns originally where people couldn't go from region to region. But then it's one of the biggest updates was that we would not be able to leave our homes without a proper reason and documentation. And police are doing checks in the streets to make sure that people are actually going out for a legitimate reason.
What if you weren't? What if you were just out having a good time? What would happen?
So that's a big no-no right now. There are fines that have been put into place, as well as potential jail time. I don't know if that's been enforced yet, but it is definitely a concern, because we really do need to take this seriously. And that was one thing even Dr. Fauci was talking about earlier today, was how I was shocked to hear that people in America are still going to bars and going out and meeting in groups, because we haven't been able to do that here. And really just to be at home. And I think really it's if there's anything around the world, when people have asked me on social media or through my YouTube channel, it's my only reaction to if there's any overreaction or underreaction, like you were asking before, is that maybe a lot of the world has been underreacting in some sense.
Especially the younger generations, you would say. I was going to ask you, if you had any advice to give Americans dealing with this. What advice would that be? And you can start with the younger generations. You know, as you mentioned, Dr. Fauci called them out today. He said, stop it. Stop doing what you're doing. Stop going to the bars and having drinks.
Yeah, so
what's
as
your
a young
advice?
person, so as a young person in his late 20s, to other people in this age range and younger, really, it's not worth it. Those things that you are looking for, that you want in life, and all of the problems that we deal with on a regular day-to-day basis, those will still be there. So really, try and take care of yourself, because it's not just about yourself, it's about those around you. And it's difficult to put into words really how seriously this should be taken, because there's just so many unknowns with the situation. Even for a period of time, I lived in the Middle East and lived under rocket fire, and I can say there were times that I felt, by comparison to this, maybe a little bit safer, because you knew where the rockets were coming from. You could hear them. You could sometimes see them. But with this, it's just there's a lot of unknowns. You don't know where it could be, who could have it, how they could have it. And so maybe coming and enjoying your home, enjoying your space, spending time with your loved ones, and really taking advantage of every moment. I think that's really important to do right now.
Hey, Rafael DeFuria, great conversation. Please take care of yourself. Stay safe. It seems like you're doing just that. And again, we appreciate the conversation.
Thank you so much for having me.
Of course. Time now, 1:47 on the East Coast, 10:47 on the West Coast. You are watching the Daily Coronavirus Update live on Fox. I'm Mike Mibach. We are live streaming right now for you, as we do every day, on coronavirusnow.com. We begin at 10 in the morning on the West Coast, 1 in the afternoon back east. Right now, I want to bring in Dr. Joette Giovinco with Fox 13 Tampa Bay, answering more of our questions. And, you know, we were just having that conversation with Rafael, and he, again, brought up the younger generations. And I'll ask you kind of the same. Time to wake up and listen to the guidelines out there?
Yes, of course. I mean, you know, we have to think about our veterans, veterans of wars like the Korean War and the Vietnam War and World War II, and then also our younger veterans, because many of them now have chronic illnesses, a lot of them linked to their service. So when we stay out of bars, when we stay out of crowds, we're helping all of those people. And we have to just work together at this point. We have to be patient. This will pass, but the sooner we take these precautions and the more precautions we take over time, then hopefully the better the outcome will be.
Well, Doctor, I tip my cap to the viewers every week. They've been sending us great questions, and I'm going to pass one along to you right now, if you could help us with the answer. Here we go. The question goes, I wash my hands for 24 seconds, but does it matter if the water is cold, warm, or hot? Doctor.
Well, that depends. Okay, so a lot of us have heard it needs to be about 100 degrees Fahrenheit, and there's still recommendations out there from some health departments to do that. But however, there really isn't a basis for that. And if you look at the CDC and you look at UNICEF, for example, they say you can use cool water. It really doesn't matter. And in fact, when you use warmer water, you're using more energy. And some clinics have just converted over to not using that warmer water and saved a great deal of money. When you use hot water, on the other hand, that can be harmful, because what you don't want to do is to irritate your hands any more than you have to. We are washing our hands really at an unprecedented rate. And so what we don't want is to have our hands dry out and get cracked, because then they can be susceptible to other types of infections. So yeah, if you're using freezing water, very, very cold water, sometimes that might decrease the amount of time you want to rub or scrub. So in that case, I would say try to be a little bit more comfortable with that temperature. Anything that's going to allow you or encourage you to go ahead and wash your hands for that full 20 seconds, I think is what we should be doing.
It is
but we
interesting.
shouldn't have to wait for that water to get warm, because that may decrease the amount of time we're actually rubbing.
Got it. I mean, I just found myself yesterday in the kitchen just standing there, and I just started washing my hands for no reason. I find myself just washing, and maybe I am washing too much now, but it is interesting you mentioned that.
Yes.
Here's another one for you. Do people with asthma and allergies at high risk, are they at high risk with the coronavirus?
That is an excellent question. That has been posed to some of the researchers who have looked at the data from China, and they keep saying that they are not really seeing that, but that makes no sense. I have heard anecdotally of people, and in fact one right here in the U.S. who was under age 50, had a very serious complication from COVID-19 and had underlying asthma. We have to think that anyone with a chronic respiratory condition could unfortunately be at a higher risk, and I think that the WHO is working on that premise. So I would say, and what they do recommend is, if you do have asthma, please be on your controller medications. Make sure you have backup inhalers, certainly, and be in touch with your doctor, and try to protect yourself, because even though we're not seeing it statistically and there's no hard data or evidence to say that they are at risk, we have to think that they are.
All right, Doctor, we appreciate your answers as always. Thank you for chiming in. Coming up on the 2 o'clock hour back east and 11 o'clock in the morning out on the West Coast. Again, you are watching the Daily Coronavirus Update live on Fox. My name's Mike Mibach. We are live streaming right now at coronavirusnow.com. We always start this every day, again, 10 a.m. on the West Coast, 1 p.m. On the East Coast. Well, it's not just groceries. The coronavirus outbreak is also leading people to grab guns and ammunition. Fox's Matt Galka shows us one business in Mesa, Arizona.
If you can't buy toilet paper, I guess you buy guns and ammo.
Although the guns and ammo might not help when nature calls. Guns Etc. owner Ron Sega says he hasn't seen sales like this since the 8 years former President Barack Obama was in office.
He was the best gun salesman there ever was. So yeah, that was the scare for 8 years. We're going to take your stuff away from you.
Now, a different kind of fear. Coronavirus uncertainty has led to a spike of guns and ammo sales at his store.
We sold upwards of 40 to 50 guns yesterday alone.
That is a big uptick from a typical day before the virus impacted the country.
Last 3 years, 3 or 4.
Andrew Weiner isn't a first-time buyer, but wanted to beat the rush.
Kind of a normal purchase. I got a bachelor party for myself coming up, and I'm pretty sure we're going shooting, so I want to buy before everybody else panic buys it.
And even though sales are good, it still doesn't all make sense to the people buying and selling.
What scares me about all of it, though, if this is the reaction to something like this, what are we going to do as a people when something actually happens? And I'm not saying this isn't a real thing. Don't get me wrong on that, but what?
People are concerned, probably should be, but to panic to go buy guns and ammo and toilet paper, I don't know, but that's for them to decide.
All right, let's go live right now to the state of Arizona. Reporter Ron Hoon, who is with Fox 10 Phoenix. He joins us now. Ron, thanks for taking the time. I am curious, does it appear that there are these first-time gun buyers outpacing everyone else?
Well, in Matt's report from a couple of days ago, he was interviewing, for example, somebody who already had a gun but wanted to get a second one. I do think that the sort of safety, maybe overly cautious mechanism kicks in, whether you don't have one or maybe you're thinking, that you need a second. I'm not sure. I looking over comments from people all over the country, though. One person who had recently bought a gun said, "I want to get home. I want to be able to protect my family, my food, my supplies, that kind of thing. Another guy was saying, I don't want to get jumped. As crazy as things have been in some of the stores, I don't want to get all my supplies and get jumped in the parking lot. So I think people have different reasons for doing it. But Mike, one thing I really did want to point out is I just got off the phone a few minutes ago with another gun shop here in Arizona, about an hour's drive outside of the Phoenix metro area. Just chatted with them and I said, so how are sales? And the owner there said, skyrocketing. And I was kind of surprised by that. He said, I don't mean guns. Gun sales are maybe up a little bit. He said what's really going on is that people are concerned whether they have one gun or two or three about their supply of ammunition. So he said, I can barely keep the ammo in stock, and that may be where the real sort of crush is.
Yeah, not even ammo. I was wondering just in general survival gear. You know, military rations, medical kits, ballistic body armor, all that stuff's going off the shelf.
Yeah. Well, you know what's interesting about that? I was just chatting with guys at our assignment desk, and we were talking about, okay, so is this a trend that is maybe somewhat unique to Arizona? And they were mentioning a piece that they had seen over the weekend of actual lines at a couple of different gun stores in California. One was in Culver City, the other was in Torrance. So I think it's a sort of a national thing that's going on. Now, we have a little looser gun laws here in Arizona than you guys do there in California. But one of the people who was in line said, I want to be able to get in and get what I need before the, quote, doomsday preppers get to the store. So I don't know. I think it is somewhat the same mentality that a lot of other people might have when it comes to toilet paper or food, those types of things. I will just point out one really interesting thing in terms of what's happening here in Arizona today when it comes to the virus. This is our election day. And as you know, Mike, other states said, look, we're going to stand down. We're not going to have that vote today. Some of the early reports, we're just a few hours into the day's voting, some of the early reports indicate robust turnout at some of these polling locations. So, you know, whether it comes to decisions that you're going to make about the supplies you want to buy, whether it's food, guns, toilet paper, etc., that's one thing. A lot of folks in this case are looking at it and saying, even with the concern I have, I'm going to still get out there and vote today.
There you go. It's good to vote during this primary season. One last one. We only got about a minute left, but I know a lot of schools across the country have shut down. There's more children at home. So I think it's important to know that if these individuals are buying more guns, that, you know, not having them around, but you got to lock them up and put them away, especially with the school district shutting down all the schools.
Well, I think that's a really great point. And it was sort of a hopscotch measures that they were putting into place going into the weekend. Some schools said, yes, we will close down. Others were saying, no, we're going to try to stay open. In the end, the governor came out and said, no, we're going to shut everything down. Mike, I was just going to show you this. I think you'll find this really interesting.
Okay.
So this is from my Instagram from a little earlier today. I tried to put something positive out there, put some positive vibes that basically just said, after every storm, the sun's going to shine. For every problem, there is a solution, but it's the soul's duty to be of good cheer. And you know, one of the most interesting comments I got from followers all around the world was on my Hooner Fox 10 Instagram page there, was somebody in Europe saying, I actually needed to see something like this because watching what's going on in your country and over here, it still kind of feels like the world's going crazy.
There you go. I agree with you. I'm sure you're busy in that newsroom, like all newsrooms are across the country. So thank you for sharing that. Yeah. Ron Hoon there in Arizona. Ron, thank you very much. We are coming up on the top of the hour right now, and some of our viewers may be stepping away to some other programming, but we will be continuing online at coronavirusnow.com and social media platforms with the latest on the coronavirus outbreak. I mentioned I wasn't here yesterday at work because I was homeschooling my two children, and my wife was at work. Now she's doing it, so a lot of people are doing the flip-flopping, and that's it. As we pop this map up, just kind of giving you a little bit of a recap of what's going on in our country. I will say that across the world, cases are up, and it's now to 183,000 cases. Again, China, Italy, and Iran being the three big countries. Here in the United States, you can see the hotspots right there. The state of Washington, the state of California, and the state of New York. California specifically has more than 500 cases. The state of Washington is over 900, and New York is also over 900. In regards to people who have died in the United States right now, that is more than 93 people have died in the United States due to the coronavirus pandemic. A lot of talk about the market right now. You can see came out of the gate this morning on a positive note, but then also dropped a little bit after. But then the vice president held that news briefing at the White House. You can see what happened after that when they announced that they are getting close to a stimulus package that could reach $1 trillion. There's also a chance that Americans could be getting checks in the mail, possibly reaching $1,000. For those of you staying with us right now or just joining our coverage, you are watching Fox's live daily stream at coronavirusnow.com. And welcome back to our streaming coverage here of the coronavirus pandemic. Time now is 11 o'clock on the West Coast. It is currently 2 o'clock in the afternoon back east and on this very busy Tuesday right now. The first volunteer has received a vaccine in what's being called the coronavirus trial, and that's taking place in the state of Washington, in Seattle. But this milestone is just this step in a very long process. This is not something they do overnight or even in the months. This could take about a year. Let's meet this individual who has stepped forward. Her name is Jennifer Haller. She is the first volunteer to receive this experimental shot.
Hi.
Hi.
Jennifer, right?
Yes.
All right.
Everybody's feeling so helpless right now, and I realized that there was something that I could do to help, and I'm excited to be here.
Thoughts in the past, right, Jennifer? All right. Okay.
I was the first. It's unbelievable. I'm really excited about that. It was easy. It was just like a flu shot, or I had a flu shot a couple months ago. It was very similar to that process. It didn't hurt. I was very happy about that. The privilege that I have to be healthy and to have a full-time job in the tech sector in Seattle, and to be a salaried employee, to be able to work from home, to be able to take the time off to take care of my family, to take care of my kids that are out of school, and to be able to take the time to come and be part of this trial vaccine. I feel so privileged to do that. Yeah, I mean, I hope that we get to a working vaccine quickly, and that we can save lives, and that people can go back to life as soon as possible.
All right, let's check in the state of Washington with reporter Matt Lorch with Q13 Seattle, who did that interview. Man, Jennifer, she just seems ready to go, Matt. How would you describe Jennifer?
She's fantastic, and she's selfless, and that's what we need at this time, right? People stepping up, saying, I'm going to do my part. So she saw somebody post this to Facebook that they were looking for candidates, volunteers to step up and test a vaccine, and she raised her hand. And so she was part of the screening process. They tested her, she's healthy, and so she was one of 45 people. She was the first person in the country to test this vaccine, which is yesterday morning. She went to the Kaiser Permanente National Institute's Research Center here in Seattle, and she got that first shot. That was after they took 17 vials of blood. And so that's kind of the before, that's the baseline, and now they're going to watch her. And so she keeps a log every day of how she feels, if she has any side effects, how this could be affecting her. And then she'll go back weekly to get more blood tests, and then she'll get a second shot, second dose of that vaccine coming up in a month. And then they'll continue to watch her, and they will test to see if it's efficient, if it will actually work as a vaccine. So it was developed by scientists at the National Institutes of Health, along with a company called Moderna, which is a biotech firm out of Cambridge, Massachusetts. And they've been going at lightning speed with this thing to get it to this point, to get it to the point where they can test it. In fact, Dr. Anthony Fauci talked about this yesterday at the White House, the speed with which they have worked to get to this point and start the test. Once again, they're going to be watching 45 individuals. If you're wondering who would do that, who would put themselves potentially at risk or even risk side effects and symptoms that could come with being a part of a test like this, they do get compensated $100 for every visit. If it's all said and done at the end, it turns out to be about $1,100. But I asked her about that. Jennifer Haller, 43-year-old mother of two, she's a wife as well. I said, hey, was that part of your calculus in deciding I'm going to be a part of this test?
Sure.
And she said, absolutely not. I work in the tech industry. I have a well-paying job. I am doing this because we all feel helpless right now.
But she sat
and
down
what can
with,
we all?
She sat down with her family, and they obviously had a conversation on whether or not she should do this, especially that she is a mother. But you didn't get a sense that there was any doubt in her mind.
Absolutely not. She was so proud of herself. In fact, she told me that. She goes, I'm proud of myself right now. I'm sure her family and friends are proud of her. Now, she's not at risk. Unlike other vaccines where they inject you with a small portion, a very small portion of the virus that won't put you at risk, or a kill portion of the virus, a virus that is not active. With this, they aren't using any of the virus when they inject you. Essentially, it uses what's called messenger RNA, and it attacks a protein that is encasing this virus, and it blocks its ability to attack the human cells. And so I'm not a scientist, I don't pretend to be, but essentially that's how it was explained to me. So she's not going to be at risk of contracting the virus or carrying the virus because she was injected with this vaccine. You know, fingers crossed. You talked about this is the long game, Mike, and it really is the long game. Dr. Fauci said yesterday this could take up to 18 months. You know, once again, they're working with lightning speed, but at least a year to develop this vaccine. But we don't know how long this vaccine is, or this virus is going to be spreading within our communities. I mean, we have heard the experts talk about this. We have seen that it is spreading at the equator. It's spreading in the southern hemisphere. So it's not like the weather is going to get warm in California where you are, or around the country where people are watching this, and all of a sudden this is going to go away like the flu. We don't have any indication that that may be the case with this virus. It may peak and drop because it is spread through our community, but there's no indication when the weather gets warmer that it's going to die off, which is why there's such a rush to come up with an effective vaccine.
I know we're here talking about Jennifer, but since I have you, Matt, I mean, look, I'm a reporter, you're a reporter, you're in a state that has a lot of cases, coronavirus. What's it like right now in Seattle? What's life like? Well, what's it like for you working and walking the streets and being in the truck and going and getting these interviews?
It's relatively empty on the streets. I mean, my commute, I live in Redmond, which is where Microsoft is headquartered for those who have never been to the Pacific Northwest. My commute in the morning, working kind of banking hours, coming in at 9 o'clock, you know, it typically take me about an hour and 15 minutes. It's been taking me less than a half hour. Nobody is on the streets right now. We've had 50 deaths in the state of Washington. That's more than any other state. We've topped 900 cases, confirmed cases of the virus, which is second only to New York. Last night, the governor instituted a shutdown of all restaurants, bars, and other businesses, recreational facilities where people gather. The state of Washington right now is following the federal guidelines saying don't gather with more than 50 people. And really try to keep those gatherings to less than 10 people, which is following the CDC guidelines. And businesses are adhering to that. We just saw big Seattle-based businesses like Nordstrom and REI shut down.
Yeah.
Seattle-based Starbucks is shutting down many locations, becoming grab and go at other locations. All restaurants here, as of last night or this morning at midnight, are now shut down, and they are now operating on takeout or grab to go only. There are major concerns within our economy, like every economy. Boeing is headquartered, and much of their production is still going on here in Western Washington, in Renton, and up in Everett. It looks like there may be a short-term buyout for Boeing as the airline industry is so radically hit by this slowdown in our economy. Nobody's flying right now. Alaska Airlines is headquartered up here. It's talking about, we've heard reports that they may be shutting down flights. They haven't gone so far just yet, but they're canceling all flights for the most part without cancellation fees.
It's a different world.
It's just a totally different world. You know, thankfully, we have Amazon headquartered here who has said, we have demand right now for delivery drivers, for those to work in the warehouses.
They're going to be hiring.
They're going to be hiring 100,000 workers is what they're saying right now. And so that's going to be a lot of wage workers. 60% of our nation is made up of wage workers. These are the folks who are going to be hit the hardest. These are a lot of folks who work paycheck to paycheck. And when they lose that paycheck, they're not going to be able to pay the rent. And so thankfully, Amazon is one place that will potentially be hiring through April to fill demand. And that's just because so many people don't want to go out and buy products right now at the grocery store and elsewhere. And so they're ordering those products on Amazon. And Amazon has said, listen, we have delays that we haven't experienced in the past because demand is so great for online orders. Thankfully, they'll be hiring 100,000 people to fill some of that demand.
Well, not a lot of good news out there every day. We continue to cover this virus, but that is a bit of good news. When there are estimates we could lose 1 million jobs in this country just this month, but there you have Amazon, where you're at in Washington, ready and committed to hire. Matt Lorch with Q13 Seattle. Great conversation again. We appreciate the time, Matt.
Hey, Mike, I appreciate you guys offering this service on coronanewsnow.com. It's essential for us to stay dialed in, and thank you for doing it.
Copy that. Right there with you on that one. All right. Welcome again to the Daily Coronavirus Update, live from Fox, where Matt was there. It's 11:10 on the West Coast. We start this daily update on coronavirusnow.com every day, starting at 10 a.m. on the West Coast, 1 in the afternoon back east. Speaking of back east, I want to bring in a live picture right now from the nation's capital. We are waiting for a news conference to get underway. I believe this is tied to the Senate. Let's listen into this for a little bit here.
This election day itself, my understanding from Frank LaRose is they have 10
All right,
days,
this is not the news conference I was looking for. This is a news conference going on in the state of Ohio, but we are awaiting the U.S. Senate to hopefully push through a stimulus package here. There it is. There's the nation's capital. Microphone is up, so as soon as someone comes up to that microphone to address the reporters there, we'll look to bring that to you live. Right now, we're going to go back to the Fox 7 Austin newsroom and check back in with Dr. Pradeep Kumar. Dr. Kumar, thanks again. You're still here. I thought you took off. It's great to see you again.
Well, nice to see you. Well, I'll hear you anyway.
Hey, let me ask you this. Biggest concern right now across the country from your eyes?
You know, it's just the greatest spread of this disease, and I think that we're all doing really well. Just in Austin, since the last time I've spoke to you, the mayor of Austin has just imposed closing all bars and restaurants and no gathering greater than 10 people. So everybody's concern is the same: is flattening the curve. The curve is still going up, and a percentage of those people that are on the curve are going to be hospitalized and they're going to die. And so that's the thing that's weighing on all of our minds, not just for the community, but certainly for our own family and friends and our loved ones, that we're hoping that they're not on the curve. And if they are on the curve, we're hoping that they don't fall off. And so that's the biggest concern that we all have. And that's the reason that we're taking all these extreme measures. This is unprecedented. And we're, you know, the good thing, I guess, there's not a good thing, but like we're all in it together as a human species. You know, there's compassion and there's caring, and, you know, people are looking out for each other. And I feel very comforted and you know, kind of reassured by that aspect of how we're all behaving.
Oh, great point. You're in Texas, and just will pass along to our viewers. Mentioned it a little bit earlier, but the governor there, Greg Abbott, today activated the Texas National Guard to be prepared to assist with the response efforts for COVID-19. All right, we keep getting all these great questions from our viewers, and I want to pass one along to you right now, Doctor. Here it is. Some seniors have food delivered to them. Should they be worried that their food could be contaminated? That's from Rita.
I think it's a very low risk. You know, like we said, how is the virus spread? The virus is spread from human to human. There's no evidence that it's surviving on your food or on your package, you know, for a prolonged period of time. You know, the delivery guy, if he's asymptomatic and he might be infected and it's on his hands and he might have left it on the outside of your packaging, that chance is very remote. And so I think that the chances that you're getting food that's delivered to you that's contaminated is very low, and it's not something you need to be concerned about. But, when you pick up food, when you go outside to come inside, the measures that we've always been recommending since it started, that strict hand washing, of course you're going to wash your food and all that before you use it. But I think that the fear of the food it should be very limited. I'm comfortable with grocery delivery to our house.
Good to know. Let's go to the next one here. For people who contract and survive coronavirus, are they left with lung damage?
No, there's no evidence that you're going to be left with some long-term lung damage. Once you get over it, it should be gone. It should be. You shouldn't have any long-term sequela. It's not like some of these other viruses that can, like for young kids that have, respiratory syncytial virus or at increased risk of asthma. There's no evidence that the coronavirus leaves you with any long-term lung damage. I thought the question was going to be, can you get infected again? And that's a better question. Like once you get it, are you immune, or is it going to happen again to you, or are you still at risk? And we still don't know the answer to that. But so far, it doesn't seem like across the world that there's been a lot of reinfection. So that's a good point. Once you get infected, maybe there is some immunity that develops, and you're a little bit more resistant to further infection, and maybe you're a little bit freer.
Yeah,
I'm hopeful.
I'm curious to see what will happen in China as well. If they're going to, now that they're starting to congregate again, and I think the Basketball Association is playing there, whether or not they're going to see another bump or even a spike, we'll have to wait and see. Here's another viewer question. We're going to go inside restaurants. I know some places across the country, restaurants are closing, but not everywhere. So here's the question. I'm a waiter, and I still have to go to work, but I don't like giving people pens to sign their check. What should I do?
That's a great question, and soon I imagine that viewer with a question is not going to be going to work in the near future. I bet you that what we are seeing in Austin and other places, we're going to find sheltering in place is going to be a more common scenario. But if you're left to having to use that pen, you ought to just wipe that down. I mean, and to be ultimately careful. Right. I mean, hopefully you have non-touch ways to sign things. But I've signed a receipt today. I used my phone to do it. But even when I'm using a pen, or even that even when you use your phone to pay, you have to take that little stylet and sign it. And I myself had a little concern about that. And I was looking around and hoping that I'd brought in some wipe or something to wipe it down. It's not being overly concerned. In this time, this unprecedented pandemic, it's a reasonable concern. You're not being nutty or freaking out to think about the pen that you use with the stranger whose contact you have no idea of. The risk factors that they possess onto you is a reasonable thing, and that virus can transmit from that pen to you. It is surviving for a finite period of time, and I understand the reason for that concern. I would be careful that if you're using the pen that you find something to wipe it down with.
And
Doctor, or if you don't want to go to that extreme, that as soon as you finish, just go wash your hands.
That's it. Wash your hands. I keep hearing that over and over. Wash your hands. Best piece of information out there for everyone. Hey, let's talk about students right now, because a lot of school districts are closing their schools, but they're also still providing free lunches for those students who need those lunches and breakfasts every day. So here's the question on that. Free school lunches that are being prepared, is there a protocol to keep them from becoming infected with the virus?
Yeah, like we said earlier for that delivery, I think that the food source is safe. I do not think that this virus is going to survive on our food for a prolonged period of time that's going to make it a vehicle or a vector for transmission. It's the people handling the food that are going to be the vector. And from what I understand, we're taking the ultimate precautions. Even I see at the grocery store that even the people that are working there are wearing gloves. It's not enough to wear gloves, right? That's still on your glove, right? You have to change those gloves periodically, right? You have to get rid, if there is potential for virus on your glove, you got to shed those gloves and put on some new ones, because the gloves can hold on to the virus just as easily as your hand, but it kind of gives you the reminder that you don't want to touch your mucous membranes. So I think that the food that's being delivered at these school districts, that they also possess pretty low risk, and I would feel comfortable delivering and handling and eating that food with the same precautions that we keep talking about over and over again. When you get these items, to wash your hands and wash the food. I think it's safe.
All right, Dr. Kumar, we appreciate your time again. All great questions and all great answers from you. Thank you very much. Time now is 2:18 back on the East Coast, 11:18 on the West Coast. You are watching the Daily Coronavirus Update live from Fox. My name is Mike Mibach. We are doing this every day at coronavirusnow.com. Again, we begin at 10 a.m. on the West Coast, 1 in the afternoon on the East Coast. The entertainment world. We've been talking a lot about the sports industry and how that's taken a big hit. Summer concert seasons have started to take a hit. I know I'm going to a concert in July up in the Northern California area. Maybe not anymore. Hollywood has been taking a hit. A lot of films have stopped production. Right now, let's go down to Southern California and check in right now with the TV editor for the LA Times right there, Matt Brennan. Matt, thanks for joining us.
Thanks for having me, Mike.
Hey, it just seems like every day there's something new developing. What is the state of Hollywood, would you say, the state of Hollywood when it comes to film production?
Well, most films and television series have halted production. Right now, they're saying temporarily, say 2 to 3 weeks, while the situation shakes out. There are restrictions in places like LA and New York, where a lot of films and TV shows are made, about how much movement people can do in terms of going to work and how much the safety issues at hand. But I think what we'll see going forward is a continuation of some of those disruptions if the various sort of recommendations to self-quarantine go on longer. As long as the CDC recommends that we limit gatherings to 10 or 50 people, a couple hundred people on a film set or a movie or a television set is just not in accordance with those recommendations.
You know, Matt, when they stop a production like that, we've talked about the airline industry taking a huge hit, losing all the money that they're losing every day. When they stop production, do studios lose money on that?
Well, the cost of starting and stopping a production is one of the sort of considerations here. And so a number of shows, for example, on the broadcast networks like ABC, CBS, and NBC, as Vulture reported yesterday, will not finish shooting their current seasons because the cost of shooting 2 more episodes or 3 more episodes is prohibitive in this case, especially because we don't actually know when production can resume.
You know, the other day I was at a friend's house when my wife alerted to me that Tom Hanks and his wife came out and said that, hey, we tested positive, we have coronavirus, we're in Australia, and we're at a hospital. They're not at the hospital anymore. But what was the reaction in Hollywood? You know, because just in the house that I was, it was like, oh, as soon as a Hollywood star gets it, it feels like everyone's attention is like, wow, maybe this is something we need to pay attention to.
I do think the level of attention to celebrities, both contracting COVID-19 and just generally being tested for it at higher rates than the general population, is in part because they're just sort of more well-known than the average citizen. I also think it's because they all have large platforms like Instagram and Twitter where they can make these announcements that some regular Joe cannot. I do think that in some ways it drove home the fact that this disease doesn't know borders of class or race or occupation or nationality. And in the days since Tom Hanks and Rita Wilson announced that they were in isolation because of the coronavirus, folks like Idris Elba and the actor who played Tormund on Game of Thrones have also announced that they have tested positive in all kinds of different locations.
Yeah, I thought their post was pretty positive yesterday, the way they relayed that message. I know yesterday you talked about Saturday Night Live in a tweet. The story there is they shut down production at SNL.
Yeah, so Saturday Night Live was scheduled to come back on March 28th, and NBC confirmed yesterday that the show won't be returning until further notice. And that is following the late night shows in both New York and LA have largely, they initially announced that they were going to shoot without a live audience, and then very quickly sort of made an about face and decided to go on hiatus, at least until the end of March. We'll see whether they can come back at that time. Again, I think it will depend on the latest recommendations of the CDC and local governments, which I think most film and television productions are interested in following the top health guidelines.
Hey, Matt, I was curious about the impact on the fall season, fall of this year, because we are in the midst of the spring season and TV shows, pretty, fresh, new episodes all the way through the month of May. And then you hit the summer season. Are we going to see an impact come, September and October in regards to what we watch on air?
Well, I think it will. One thing I would say is at some level, you're already going to have an impact on what we watch. As I mentioned earlier, some shows won't actually have their planned season finales. Others, like Fargo on FX, have delayed their release date because production is halted. I know that Disney Television Studios, among others, have put a lot of pilots on hold, and many of the networks have made their upfronts either digital or potentially, not going to move forward with them on the same timeline, because the new shows that would roll out in the fall actually haven't, been able to move forward on schedule. I think whether we'll actually see a huge effect on the fall schedule will depend a little bit on whether this is a 2-week or a 4-week or an 8-week or a 12-week stoppage. But I certainly think one of the interesting things about covering television right now for someone like me is trying to juggle both the breaking news about the coronavirus and its effects on the industry while also having the regularly scheduled spring program roll out as planned. Most streaming and cable shows where production is finished before the season begins will premiere, as originally intended.
Yeah, different times we're living in. Matt Brennan with the LA Times, the TV editor there with that publication. Matt, we appreciate your time. Thanks for joining us.
Thanks for having me, Mike.
Okay, from Los Angeles, let's take you back east to Washington, D.C. Senator Marco Rubio is in front of a microphone talking about the coronavirus pandemic right now. Let's listen in if we can.
So we have to try to do the best we can, or, some of those other issues that we've talked about in the past just won't matter in that context.
Can we ask you about the Clam Nugent's plea to send checks directly to Americans? Do you support that?
Well, again, I've been focused on the small business piece of it. I think there's an effort or a desire to provide people through some mechanism the ability to have immediate cash on hand. But the thing I haven't studied that proposal carefully because, frankly, I've been spending my entire time trying to come up with a way to deliver assistance to small businesses, which employ the vast majority of Americans, many of whom are already being laid off, and many will be laid off by the end of this week if their employer does not believe that they will have cash on hand to be able to meet payroll and sustain them for 4 to 6 weeks.
Senator, how do you feel about can you talk about what specifically the administration is proposing to help small businesses? Is it grants, and what kind of response is it getting from the Senate?
It is frankly using an existing program. People think they call them SBA loans, but they really are loans made by 1,000 banks across the country. 60% of them are community banks, but all of the 5 major banks are involved in this program, in which the government guarantees these loans, and these cash transfers are made to small businesses. In this particular case, we'll probably have to guarantee the entire loan, and we'll have to work on a generous forbearance in the future down the road. This is not permanent. This is just for 6 months. But the absence of that, you're going to have mass closings of small business and a huge surge in unemployment and tremendous friction in our society as a result of it.
How did the conferences react to the overall price tag of this proposal? Do you understand?
I don't really, I don't, obviously, look, I don't think it's a price tag issue for the conference as much as it is really the first portion of it, which is the House's bill requires paid family leave, and there are a lot of people that believe that it's currently structured, it's incentivizing employers to lay off workers so they wouldn't be liable for that obligation. And so the concern is, what is the right way to get those people who are laid off assistance? Is it through the unemployment system, or is it through the direct payment that the administration is considering?
Does he want you to amend does he want that bill amended to include? Does he want the bill amended to
I don't want to speak for the Treasury Secretary, but my sense is that he would prefer to have, for us to pass this bill and fix whatever's wrong with it in a follow-up bill.
Can you give me a timeline for when this is going to happen?
All right, there you had Senator Marco Rubio talking about working on a bill. The House has its plan. Senators have their ideas, trying to come together and agree on a stimulus package that the president would like to see passed, if not today, possibly tomorrow, definitely by the end of the week. The president earlier today is saying that they are looking at $1 trillion stimulus package to inject into America to help small businesses, to help Americans sitting there at home. There is a possibility, the Treasury Secretary said today, Steve Mnuchin, thinking about this idea of actually direct cash into your pockets, about $1,000. Would that help? Would that not help? That's being debated. We'll hope to have a stimulus package maybe by the end of the day today. We'll have to wait and see. Time now is 11:28 on the West Coast, 2:28 on the East Coast. You are watching the Daily Coronavirus Update live from Fox. My name is Mike Mibach. We are streaming right now on coronavirusnow.com. We start this every day, 1 o'clock Eastern and then 10 a.m. on the West Coast. More viewer questions. You've had great questions out there. Thank you for sending them our way. You can always do that by Facebook about little things. It could be about food, going to a restaurant. It could be about a pen. Do I touch it? Do I not? Do I gather with friends that I care dearly about? Do I not? I want to bring in Dr. Ranjun Misra, internal medicine specialist based in the San Francisco Bay Area. Thanks, doctor, for once again joining us.
Thank you, Mike.
So one question I have before I get to the viewers is humidity, temperature. How much does that play a role in this virus? We just still don't know yet, do we?
We still don't know, and I wish I had those answers because maybe that would help calm the public down, but we don't have those answers. So just act like everything and anything can help you transmit the virus. Wash your hands, wash your hands, wash your hands. Can't say that enough.
Because I keep hearing out there sometimes, you know, this is my own daily life and interaction with others, like, hey, once we hit spring, and I think spring officially starts in 2 days, but once we hit spring, this thing's going to die.
Right, and I think what we're trying to do as public is trying to model this novel coronavirus after the flu and after the common cold, which usually you see them tend to die down when the temperatures increase. But we just are not seeing that with the coronavirus. And so I think it's very hard to make an assumption like that. I wish we could. And I think that would give some sense of hope to us. But I think it would be a false sense of hope right now without actually having scientific data behind that.
Got that. Copy that. All right. Let's get to one viewer question right now. It's a short one, but a good one. Are paper masks useless?
Paper masks meaning the surgical
to cover your
masks
mouth.
that people
Yes,
are using?
exactly. That's
Okay.
my assumption of
Okay.
what they mean there. Yes.
Sure. Okay. So let me elaborate. I have been talking to my colleagues, not only in California, but across the nation. And what we really need for the public to understand, unless you're sick and unless you're taking care of a sick person, please don't go out there and buy masks because we really, really need these for our healthcare workers who are on the front lines. And I tell you why, because we're already seeing a very big shortage of personal protective equipment for our healthcare workers. And if the public were to now go out and start buying the masks that we really need, that's going to create, a big problem for us as we try to treat patients who really need our help in hospitals and clinics and urgent cares.
Great point, doctor. Next question, I'm going to say, here it is. Is the coronavirus going to return every year like the flu? Again, one of those questions we probably don't know the answer yet.
Right. We don't know the answer to that. But from what we're seeing in the reports that we're getting, we're probably going to assume at this point that this might be something that may come back. And it may end up just being a flu, cold, and coronavirus season starting next year. But, these are all assumptions. We don't really have the true and hard facts for this. So very hard for me to say yes or no
Right.
in either direction.
Well, one thing I'm curious about is what's going to happen in China. China hit hard first, 80,000 plus cases, and now slowly but surely they're getting back to normal a little bit, just day-to-day life there in China. I'm curious if we see a second, maybe not even a spike, but a second kind of hump of cases coming back again. What do we read into that?
So I think there's so many possible things we can hypothesize from happening, right? And that's just what it is. It's a hypothesis. What if there's a second surge? But we haven't seen that yet. So I think that it would be prudent for us to not have all these different hypotheses out there because I think they're just going to create so many more questions and more panic within us as a community. And I think we should just kind of stay away from that because we're not seeing that right now. What we are seeing, which is positive news in China with their lockdown that they implemented, is for the first time in the last week or so, their rate of new outbreaks has slowed down. And that's really what we are aiming to do as a global community, not just each country individually.
Just about 20 minutes ago, we introduced our viewers to the one individual who is now part of the vaccine trial. Her name's Jennifer. She lives up in the Seattle area. This next question from a viewer is tied to this. How long will it take to create a vaccine for COVID-19? I've heard a big range, doctor, from 6 months to 18 months.
From what we're understanding right now, with all the proper procedures in place and then the clinical trials happening, we're seeing at 18 months, which is probably sometime next year, we'll have a vaccine that we'll be able to implement for our patients.
Doctor, do you think, it seems like we're doing enough right now, but in the United States specifically, but what else would you like to see accomplished here in the States as we move forward and attack this pandemic?
So I think the main thing that I would love to see both here in California and at a national level is implementing social distancing. We're obviously doing it here in California, but at a national level, and also implementing some kind of national closure and shutdown, because we're at a tipping point right now. And if we don't all take this seriously, we could go one of two ways. We either follow in Italy's footsteps and have that peak and have our healthcare system just be bringing down to our knees, or we could actually flatten the curve. And the most important thing to understand during this time is we need to follow the guidelines that are being set forth. So right now, the fact that we are in a shelter from home for the next 3 weeks, we need to obey that mandate, and we need to make sure we can do anything we can as an individual, as a community, to slow down the rate of spread. Because if we don't, we're not going to have that capability for the health system to meet the needs that we're going to have in the coming days, in the coming weeks, in the coming months.
I know in the Bay Area, you're experiencing the shelter in place for those 6 counties there, nearly 7 million people impacted. I actually worked from home yesterday, or I didn't work from home. I took the day off because I had to homeschool my children. My wife worked. And as soon as I heard about the shelter in place, I picked them up. We went to the store. I mean, I had never seen this market so crowded, and I think it was on the news of that shelter in place. So another viewer question is kind of tied to this, because I didn't think about it when I bought the food, but should you avoid using cash and coins at stores when it comes to the coronavirus? Doctor?
Good question. If you have the ability to not implement, cash and coins, then that would be recommended. WHO is actually recommending cashless payments because obviously tender is a way to pass not just the coronavirus, but all kinds of other germs. So if you have that ability, then I would definitely implement it, yes.
What about mass transit? I mean, you're very busy there in the Bay Area with mass transit, and not a lot of people are taking it anymore, but people are, because some people do have to go to work. Would you encourage transit agencies to stop transit because of so many people getting on the trains and ferries and the potential that they could contract the virus on a train or a ferry?
I think that's a pretty complicated question, because we still need to get essential workers to their workplace. And if that's their mode of transportation, many people don't own cars. So how are they supposed to get to work? So I think shutting down the transportation system would bring up a whole new set of problems. I think that when you're on the transportation system, we can still do little things and implement little things that are going to make a big difference. So number one, we can all carry sanitizer with us to continuously sanitize our hands, make sure that we're not touching surfaces we don't need to, we're not touching our faces. Obviously, no one's going to be washing their hands while they're on the transit, but also maintaining that 6 feet distance. And if you are sick, please stay at home.
Stay at home.
I can't stress that enough.
There you go. Doctor, as always, thank you again. We appreciate your responses to those questions, and thank you to the viewers as well for all those questions as well. Time now, 11:37 on the West Coast, coming up on the noontime hour, and a lot of school districts out there are dealing with this. Students having to stay home, parents are having to stay home. Unfortunately, there are a number of students across this country who depend on meals that they get from schools. Are they getting those meals now that they don't have to go to school? Well, in some cases they are. We've seen tents popped up. We've seen other individuals volunteer their time. Food banks step up to the plate. I want to talk about this more with Lisa Davis. She is the Senior Vice President of No Kid Hungry. She joins us live from Washington, D.C. Lisa, I mean, we're talking about hungry students who could go without food. you know, that vital meal in the morning breakfast for weeks, if not months. How big of a concern is this for you?
It's a very big concern. You know, as schools have been rapidly closing, right now 39 million students across the country are out of school, some of them for weeks at a time. And well, for many parents, it's an inconvenience as we scramble to find childcare and make arrangements. For others, it is a very serious worry. They have to make up for those free and reduced price meals that their kids relied on during the school day.
Are you hearing from where you are in regards to the response that districts are stepping up to the plate and somehow, some way providing meals for students?
Districts are definitely stepping up to the plate, and huge shout out to all of the food and nutrition service workers across the country that are doing that. They need the resources and the tools to be able to really reach those kids. There's no one size fits all, and the things that they can do now, they are doing, but we need Congress to take action to make sure that our communities have both the funding and then the flexibility to cut through the red tape and be creative and flexible, implementing new ways to reach kids.
Because I know there are some schools that, you know, feed their students in the summer. They're allowed to do that right now during this crisis we're facing. It would be nice, though, as you mentioned, the funding, and that's probably what it's going to take, is going to take money from Washington so that we can have, you know, tents popping up everywhere, no matter what school you go to.
Exactly. I think for schools to be able to respond quickly, and every day there are new school closings. I think 38 states have closed all of their schools, and every single state has at least some schools that are currently closed or will be closed over the next few days. But they need the flexibility to be able to set up distribution points in communities closer to the kids. They need the flexibility to be able to allow families to pick up more than one meal, to take several days meal at a time. And we also need funding through SNAP or a similar EBT card so that parents who can't get their kids to a distribution site because they're working and the kids may be home alone or they don't have a car and transportation, for them to be able to have resources to buy additional food when they do their grocery shopping to make up for those school meals.
What about food banks? You know, food banks, they're so vital in communities, and they often step up to the plate and provide food for so many. But at a time like this, when, and this is outside of children I'm talking about, that they are needed by adults out there who are trying to feed themselves as well. But do you expect a lot of food banks to help out school districts?
I think every food bank across the United States is already working kind of at a community level to figure out what the needs are with older people who are very vulnerable at home, kids out of school, families having their hours cut or potentially losing jobs. And I think food banks are essential, but private charity can't fill in the gaps. They can't fill in big gaps from a coordinated government response. We need our federal nutrition programs to be leveraged. We need to empower communities to make decisions and to move quickly without getting bogged down with red tape. We need additional funding, and we need our food banks, our churches, our Boys and Girls Clubs, and our United Ways. All of those pieces have to work together to help address this unprecedented need that we're seeing across the country.
20 million students rely on free school meals, I mean, according to the U.S. Department of Ag. But no kid hungry. From your perspective, what is your biggest, man, I don't know what your biggest concern is, I guess what I'm trying to say. Not what you can't do. Obviously, you do so much, but is there something right now that you just are not able to do and that's concerning to you?
I think it's important to remember that this is an unprecedented situation. Right. When there's a natural disaster, unfortunately, because they happen with some frequency, there's a playbook. Organizations know what to do and approximately how long it'll last. This is completely unknown. And there's a double whammy effect of the increase in food insecurity that's caused as kids miss school meals, and also the economic hit a lot of families are taking as restaurants close down, stores cut back on hours. And so we have put together an emergency response fund, and we are making grants to local school districts, food banks, other community organizations that are out there feeding kids. And with the scale of this pandemic, I think there's always a need for more funding to help meet those needs. We also really, really need Congress to take action to make sure that we are empowering our communities and giving them the resources to be able to respond quickly and to feed these kids.
All right, Lisa Davis, Senior VP with No Kid Hungry. Lisa, thank you for all you do, and we appreciate your time on this Tuesday.
Thanks, and thank you for bringing attention to this really critical issue.
Of course, that's why we're here. Lisa, thank you again. Have a great rest of your day. Medical questions, we've been getting a lot of them, trying to answer as many as we can. I want to get back to Dr. Pradeep Kumar from Fox 7 in Austin, Texas right now. Doctor, thanks again for hanging in with us. Everything's developing so fast, so furious over the last couple of hours just while we've been on air as well. These tests, people are just saying, hey, give me the test. Where are these tests? In the meantime, we know we're not going to have them all right away. What else is concerning to you other than the tests?
Well, I mean, certainly you're right that everybody's worried about the inability to get tested. At least we're letting local authorities form their own tests, and they're starting to become accurate, and we're starting to hear in Austin of a couple of places where we can get tested, so that's good news. You know, the concern really is about having the supply, the personnel to take care of the people that might start getting sick. Do we have enough ventilators? Do we have enough hospital beds? Do we have enough personnel? Do we have enough EMS services for the things that might come about if all these draconian measures that we're taking doesn't work? If the social distancing, the staying, the shelter in place, if it doesn't work, what we're going to be looking at in the near future or in the future is very sick people that need ventilatory support and hospital care. And so that's on the minds of most of me, myself, and my colleagues. Another concern is just how do we practice? We have these people that are coming into our office that are sick. They don't have COVID, but they have abdominal pain, they have high blood pressure, they have diabetes, and they have to get care. And so setting up the infrastructure on our end, the telehealth, the ability to take care of these patients remotely is what's concerning a lot of us physicians. Taking care of the very sick with COVID, take care of the people that are sick without COVID. That's forefront for us.
You know, I take care of my mother. She's 81. She lives in my home. She's a recent cancer survivor. She beat colon cancer, but she has follow-up appointments, and we're trying to determine, well, I don't know, Mom. I don't know if you should be going in for these appointments or not. What would you recommend to those senior citizens who are debating, do I go to my doctor's appointment or not?
The default should be don't go. The default should be don't go and call. And because we're right now, our practice and practices throughout the country, we are creating telehealth services. We're finding ways to communicate, particularly with those patients that are above age 60, to avoid them from coming out into public and being able to shelter in place. And so if your appointment's coming up, give your doctor's office a phone call and find out if they have set up that infrastructure, or if your underlying condition is so critical that we really need to have that interaction right now. You know, sometimes these office visits can be delayed about a month with no adverse consequence. So I think it's appropriate that if you're above age 60 to really be communicating with your doctor's office rather than just showing up for your follow-up office visit. That's a really good question. And I'm glad for the opportunity to get that out to those people above age 60. Our own practice, we're cutting out all, I'm a gastroenterologist, so we do a lot of colon cancer prevention. We do colonoscopies. And right now we've canceled any office visit or any elective procedure for that purpose, because this is something that we can do a few months from now, and we don't need to do it right now. And so that's what we're doing.
Real quick, what about the flu shot? Does it work to prevent it? I mean, obviously it's not the vaccine, but if someone's saying, hey, I didn't get the flu shot yet, should I run out and get it?
No. That's influenza virus that works on, the vaccine works on that. This is coronavirus. It's a completely different virus, and there's no reason to expect that any immunity you might get towards influenza would cross-react and allow you to prevent the coronavirus. I don't think that's a strategy that has rooted in any evidence.
Good to drive that point home. Dr. Kumar, appreciate the time. Thanks again.
Thank you.
Okay. Back in the Bay Area, we were talking about the San Francisco Bay Area. Shelter in place is in effect for 6 of the 9 counties, impacting nearly 7 million people. Right now, I want to go live out there to Marin County, just north of the Golden Gate Bridge, and bring in Ryan O'Donnell. Ryan, thanks for taking the time. I understand here that you were recently tested and that you tested positive for the COVID-19. What were your symptoms, and what eventually made you go in?
Well, hey, Mike, how you doing, by the way? I was traveling internationally. I was in Europe, and I was flying home through Heathrow and LAX on February 29th. And about 11 days later, I started feeling the side effects, the symptoms, I should say, of a headache. I had chills at night, and I didn't feel terrible, but I knew something wasn't right. So I called my primary healthcare provider, and they coordinated with Marin County health officials to have me go through the drive-through test. And the whole time, I really didn't feel bad. I would have probably, brushed it off as, allergies or pollen in the air. But I had an inkling that it was more than that because of the timing. And I got tested on Friday the 13th. And on Sunday, they called me to let me know I was positive.
So there's so many debates about whether or not we have so many tests. Were you surprised that you were actually going to get tested?
Well, I think I got in right before everybody really rushed them to get tested. And I was a little surprised. They said they were just going to monitor me. And now they aren't testing people with my symptoms. But, I want to let people know out there that, you could easily be carrying it, having minor symptoms, and you're probably positive. I had just minor chills at night, kind of a hot, cold sensation on my skin, which I still have since Wednesday, and a minor headache. But, I think the virus is using people like us to spread and walk around.
So here you are, someone who has COVID-19, and we only got about a minute left, Ryan. But what would you tell people out there how you're living now and how they should live their life moving forward?
Well, right now, I feel okay. I'm just trying to take a lot of stuff for immunity boosters, so the symptoms are less. I'm hanging out with my family. We've all been exposed to each other for the last 14 days. We are just enjoying our time together. There's highs and lows, but we feel fortunate to have a very mild form of it. And I just, everyone just don't be afraid out there, because it comes, it'll run its course. For me, it's just a cold-like symptoms. Stay away from your elders. This is our chance to help protect the people that raised us, and stay strong and positive.
Stay strong and positive. That's a great way to end it. Ryan, I appreciate your time. Take care of yourself. Stay strong and be positive. Great words from Ryan O'Donnell out there in the San Francisco Bay Area. Words we should all listen to. Thanks for watching, everyone. Our stream does not end, though. We're going to continue from Phoenix, Arizona. Coronavirusnow.com is the site. Thanks for watching. I'm Mike Mibach. We'll see you back here tomorrow.